Face masks are the primary defense against the coronavirus infection. In India, the Ministry of Health has issued an advisory asking all Indians to wear homemade masks if they step out of their homes. Initially, experts argued that only people with symptoms should wear masks. But as the threat of community transmission looms, universal mask usage seems to be the best strategy. It guarantees personal hygiene and also offers protection to the people back home once you return. The Health Ministry advisory calls for people to make masks from clean cloth and wear them irrespective of the possibility of exposure. So even if you do not have symptoms of the infection, it is advisable to use a mask. There is a shortage of advanced masks which are reserved for frontline health workers. So people have been advised to not buy masks from the stores but to make them at home. Also keep in mind that these homemade masks should not be used by medical professionals. That level of exposure to the virus requires specified protective gear. So if you are planning to make masks at home, these are some of the things you should keep in mind. Firstly, make 2 sets so that at least one mask is available while the other is being washed. Always rinse your hands before you wear a mask or take it off, because your hands will inevitably touch your mouth or your nose as you wear it. And these masks should not be thrown away. Make sure you wash them with soap and water and then store them in a safe place. And needless to say, every family member should have a separate mask. Even accidental mixing up of these masks could prove to be counterproductive. We are now being joined by a member of Niti Aayog and the chairman of Medical Council of India, Dr. V.K. Paul, for more insight on India's battle against the coronavirus. Doctor, first of all, my main question to you is, are masks necessary for the general public at large?
Well, I think we are in a stage where we would like to make the best use of a very massive public health response by way of the lockdown that's underway, to make use of that opportunity to be ready for the next scenario, should that scenario arrive. And we should be in a stage where a massive behavior of protecting the droplet spread to your neighbor, to the person next door, to the person with whom you are conversing, is now a necessity, and that should become a part of our overall behavior. So the timing for this approach had come, and this is an advisory for general people. These are the means through which the droplet transmission, not the virus transmission, the virus may or may not be there in you, but the droplets will not go to another person, and should you have the virus, this will provide, shall we say, the first line of defense to the people with whom you are coming in contact or are in conversation.
Right. Dr. Paul, this advisory has been given now. So are we nearing a possible stage 3 of this virus spread in India? First of all, do we have a community transmission in India yet? And secondly, the Health Ministry today in the briefing said that this is not an airborne disease that we know. It's only transmitted through droplets, which can you elaborate on that?
So firstly, this point is very important, that we don't believe as of now to have sufficient evidence to say it is airborne, because it is droplet driven, droplet carried. Therefore, a simple measure like even cough etiquette, a simple measure by way of the homemade mask that we're talking about will help us containing the disease spread from an individual. So that's one part. Second part is we want to use this opportunity when we are all tuned to responding as a nation to be ready for this behavior, which might eventually be a new normal should the epidemic goes beyond the time for a long period of time, let's say. But also your point is whether we call it community transmission or not is something that will be answered in a scientific terminology at the point when we have data, information. But remember, we have to be prepared for the war when there is peace. Right now we are dealing with hotspots. Right now we are dealing with, in a way, localized, in many sense, a localized form of outbreak. It is not the same thing, it's all over. We know it. And therefore, let's be prepared for the bigger battle should the situation worsen, and this is a very timely advisory that has gone out, and it is preparing us for further eventualities should they arise.
So what's the way forward as far as India's battle against coronavirus is concerned? Because the last 3-4 days, we have seen a surge in the number of cases, especially after that one congregation that happened in Nizamuddin, Delhi. What would your advice be to the people who are watching this broadcast?
So at least two levels. One is that our disease control strategies, which means containing it where the hotspots are, where the clusters are, tracking individuals who have come in contact, and we are tracking a few lakh people who have come in contact. So that measure has stood the test of time in a way, if you compare it with other nations, and we are doing very well. We have great strength in that, to mount that. So those efforts must continue and will continue very, very effectively. The second part is for us to be ready for a scenario which is more complicated, more complex, more comprehensive, more dangerous. We do not rule out that scenario. And therefore, as a nation, as a society, we had to be prepared to face that scenario. And there, one is how the public is going to behave. Public is going to be responsible. And one example is the right behavior, social distancing, now talking about masks. But at the other level, what the government and the state governments and the district administrations will now mount even bigger effort is to be prepared for health system to be able to respond to that larger need of looking after potentially a large number of cases. If that happens, God forbid, if that happens, now we want to use this opportunity. We are already using this opportunity, but want to accelerate all our efforts to use this time when things are still very, very manageable, to prepare to the best possible extent, very best possible extent, to face an eventuality where a large number of patients may have to be tackled, maybe in small areas, maybe in pockets, maybe in some cities, but we have to be prepared everywhere because there is no way to be very predictive about where we would be. So national preparedness of the health system is the top priority as of now, in addition to the efforts that are already underway. And of course, the final science response. India is a hub of science, technology, biotechnology, virology, and laboratories and industry and vaccine development, drug development. So I would say that is the other priority for us, to continuously work in that area, to find solutions which are not only for India, but for the entire planet, for all the countries. Everybody needs those solutions, and we have a strength.
Absolutely. Let me quickly remind our viewers that Dr. V.K. Paul is the chairman of Medical Council of India. Doctor, my next question to you is, every country is fighting its own battle against this coronavirus pandemic. How has India's response been so far? How would you rate India's response? Because we've seen the scale of the pandemic in China, in Europe, and America now. So how did the Indian government respond when faced with this pandemic?
I think it is eventually for other people to judge, other nations to judge, other agencies to judge. But I think the country has done remarkably well. Country has taken very tough decisions in a very timely manner before significant measures were taken, and even before the lockdown. We were progressing in a trajectory of doubling time about 3.5 days. And prior to lockdown itself, our doubling rate dropped to 5 per day approximately. And now, the lockdown, notwithstanding the outbreak that you are referring to, the origins of our outbreak to that particular congregation that you are referring to, we will see the impact. Time is now come, today, tomorrow, day after, we will see the true impact of the lockdown, which is the ultimate measure that you take to make sure that the virus finds it very difficult to move from one person to the other. So this effect will be visible in the next day or so. Onwards thereafter, because it takes about 14 days for the transmission chain to having been contained to become visible in terms of a drop in the number of cases and so on. So you will see that effect. And that is biologically, epidemiologically, a principle that will pay up. So India has taken that decision in a very timely way. Imagine if that decision was taken when other nations have taken.
Right.
And then we would have faced a very difficult specter. So India has the ability, and the leadership has the resolve to take big decisions in this regard, and therefore I think our level of preparedness is notable. We do know how the epidemics can behave, may behave, but our response in general has been appreciated as very timely in every which way, from travel restrictions, from other measures that we have taken.
So one final question, very quick question before I have to let you go. When can we expect a vaccine?
Well, vaccine journey is a multinational affair in the sense that many countries are running for it. But what is perhaps very evident is wherever a new vaccine is discovered, a lot of manufacturing, if not predominant manufacturing, will happen in India, and our industry would then rise to the occasion, just as it does it for measles vaccine, let's say.
Right.
General estimates are it will take about a year.
Right.
Our own Indian agencies and science enterprise is working feverishly.
Absolutely.
Create a vaccine and new therapies. And this nation will take big leadership in that regard.
Right. Dr. V.K. Paul, Chairman of Medical Council of India, I'd like to thank you for giving us your time and sharing your views on India's battle against this pandemic.